then again, of course, you had to go through all the treatment. Was that a long process?
Looking back at it now, it was 5.5 weeks of intensive treatment. So it was, every day of the week for the 5.5 weeks, Monday to Friday.
Wow.
But looking back at it now, it absolutely flew. Like, it went so fast. Because I suppose when you're having your treatment done, you're in it, you're there, and you just want to see the end of it. So for me, it flew. Now, obviously, looking back now, it was a very difficult time, but, it did go quite
That's
fast.
the type of person you are, though, Juliette, as you explained to me during the summer and earlier on as well. You go at something full on, and that's it, and you deal with it, and you dealt with it.
Well, I suppose, look, that is the way I approached it. I suppose you have to be positive about things. I think on the first day, when I went home, I had a little cry.
I'm sure you. I mean, that's normal. Yeah.
But actually, after that day, I never actually cried over being sick.
And would you have had smear tests in the past? Were you good at that? Are you good about your own health?
I suppose I would have been good, but I suppose.
Would you have had smear tests in the past? Were you good at that? Are you good about your own health?
I suppose I would have been good, but I suppose I never had a smear test. And I suppose because it's so uncommon, I suppose.
And because of your age.
Of course, yeah. So I mean, obviously, the doctors were looking for things, I suppose, less serious. Like maybe like a hormonal imbalance, something
irregular
like that.
Periods or something like that.
That kind of thing. Like yeah, look, it did come as a huge shock, but look, thank God, it all worked out good in the end.
And it's like every other cancer, I suppose, Juliette. Early detection. That's what it's all about.
That's what it's all about.
Would you say now, after what you've gone through, you've had your treatment, and thankfully you're fine, but the importance of women, especially actually young women, to have regular.
Yeah, and I suppose that's the bottom line. If you're not feeling well, or you do feel that there's something wrong, you really have to push yourself to be seen. You know your own body, and at the end of the day, no one's going to look after yourself but you. So you really have to go and approach your doctor.
And they're free smear